So Dana, how can employers mitigate the costs of employer-funded health and risk?
I think the most important place to start is with what's driving your claims costs. So taking a look at the data, what are the types of conditions, what types of services, because that will then drive your strategy in terms of the outcome. So do you need to put in a health prevention program for musculoskeletal, or do you need to make plan design changes so that people are not overutilizing running to the doctor for every single cold? Because that really will manage where you put your focus, because we don't have time to do everything, and really where you're going to have the biggest impact, because that's what you're looking for, is the impact and the health outcomes.
And what about if employers don't have that data?
It's something that you should always be able to get from your local health insurer, whether it just be as simple as, because you can get aggregated data, they will not give you any individual data, but anything more than, I'd say, 5 to 20 people, you should be able to get aggregated claims data, because it's something that your insurance partner should be doing to manage the health of their organization as well and manage the risks for themselves. So it's something that they do have. If they're not giving it to you, it was something that I would be pushing to ask for at least once a year. I mean, medical claims are not going to change as much. Once or twice a year is okay. You don't need to look at it every quarter. But it is something that they do have and you should be pushing for.
And what work has DHL done to review its health and benefits offering? I know that you guys are really active in this space.
Yeah, so we put in a proactive strategy because we are an insurance captive, so we actually take all of our own risk. And what that means is that we set the pricing. So back in 2015, we started a program where we're basically building the business case for the local HRs. We said, if we do nothing, we know health costs are going to go up exponentially year over year. So we need to do something. And we need to at least try to bend the trend in terms of the medical claims. So what we did is we created a program where we were giving an upfront discount because we're taking the risk. And then the local HR teams could go to the CFOs, the CEOs, and say, I'm getting us a discount on our medical insurance. In order to get that next year, maybe even more, because the discount ranges from 5 to 20%, I need to spend time, energy, and money on these programs. And then they report to us those programs, and we score them based off of health impact, and that then translates to their cost for the next year, or the discount, I should say, on the medical insurance. So that was a key driver. And like I said, the programs that we're asking for are really health impact programs. So we're not saying put out a fruit basket. So we're looking at things that are a cultural shift that create an environment where people have the greatest opportunity to be healthy by creating that access, creating opportunity, creating new social norms because everybody's engaged in it, and making it easier for people to engage in those healthy activities. So we do things like, have you changed your whole canteen looking at healthier foods? Are you subsidizing those healthy foods? So what are ways that we can make it as an employer as easy as possible for them to engage, which then has an impact on the health outcome, which is what we need to achieve.
And what evidence have you got of return on investment on that? Must have been an absolutely huge piece of work that you did back in 2015, and I assume you're continuing to do so now.
Yep. So we started, as I said, we were betting on the business units, and what we have seen, and it has been proven, is that where our premium should have gone as a company, based off of the medical trends of, we look at Aon, MMB, and WTW, versus where they are today, and we have seen a 20% savings, and that's being conservative, and that's just on the pure medical costs. It's not even taking into account the productivity, the loyalty, everything else, the satisfaction, all those things that come along with it, and that can be another 20% if you really think about it. But we have seen that we've been able to bend the trend and manage our claims and the costs to the local businesses a lot better.